Late Night Health continues. I'm Mark Alyn. Our guest is Dr. Rishin Shah. He is a cardiovascular physician located in Texas. You know, yesterday I was talking to a friend of Daryl's and mine.
Fred Wallen.
Yes. Well, I didn't want to give his last name.
Oh,
but,
okay. Well,
okay. It's all right.
A sports superstar.
He is a sports superstar. But Fred, like me and like Daryl, we're couch potatoes. This is not a good thing, is it, Doctor?
No, I mean, our couch potato-ness has definitely increased over the years, so our lack of physical activity is definitely causing more and more issues. But if you actually look at weight, if you look at one statistic, the number of gym memberships in the last 20, 30 years has exponentially gone up. However, obesity has also gone up. What does this mean? I mean, part of it is that I don't think a lot of people understand that really weight loss and things like that, it's primarily diet, right? Abs are made in the kitchen, as goes the saying. But nonetheless, for quality of life, for health, exercise is very important.
And the gyms are getting rich because they charge you whether you go or you don't go, right?
Right. I think my wife went once this whole month. So I mean,
yeah. Oh, okay, got it. What about you?
I try to go a couple times a week. Unfortunately, I think doctors are not very healthy themselves many times. Just working 12 hours a day, and we got some stress in our lives. Especially thinking about patients, et cetera, et cetera. But
you're thinking about, you have probably an older patient load, 50 plus, I would think, and so you're dealing with things like Medicare, insurance payments, and why are they continuously saying, we don't want you to do that procedure, or we want to charge you, we want to pay you less, things like that. So there's the stress for doctors. I get it. And you told me that you're a vegetarian, which is that's a healthy lifestyle change too. You did that yourself at the age of 10?
Yeah, we did that at 10. We I don't exactly remember all the circumstances, but we went to a talk or a play, and I took it to heart. And after that, I became vegetarian and have been so for the last 20-something years.
And what about your family at the time? Were they vegetarians or not?
Yeah, so my family's been vegetarian, so that part definitely helps. Culturally, we're Indian, so many Indians are vegetarian.
Right.
India has the highest number of vegetarians in the world. But just because you're vegetarian does not necessarily mean you're healthy. You can eat plenty of, fried, breaded, products that don't help out with your health. And if you're not eating too many vegetables, it doesn't really matter too much.
There is nothing better to me than naan and onion kolcha and things like that. They're high in carbs.
Exactly, and India has some of the highest rates of diabetes and heart disease in the world. So, patients ask me what kind of diet I recommend. I don't necessarily go into all the different types of diets because they're all just tools in our tool belt, but the general principles are kind of the same. Minimize processed foods, eat lots of plants, vegetables, fruits, things like that. So the general concepts are the same no matter what. And then you can use all the different diets as tools to kind of help you out.
Right. And, of course, Indian food can be healthy. In fact, in Thousand Oaks, where I live, there's a brand-new Indian restaurant. It's a vegan. It's advertising itself as a vegan restaurant, which is really terrific. But, again, there'll be the carbs in there. And I've noticed that a lot of vegetarians in particular are overweight, and I got to assume it because they're eating more carbs than protein, for example.
Well, Well, I'm not personally a fan of necessarily, vilifying any one macronutrient, i.e. carb, fat, or protein. In each category, there's good carbs, good fat, bad fat. So, yeah, if in carbs you're talking about donuts, pizza, white rice, white bread, that's not good for you. But if you're talking about fruits and vegetables, and you got to remember those are also carbs, beans, they have a decent amount of protein, but they still have a lot of carbs. I mean, those are all good for you. In general, if we do recommend, if patients are trying to lose weight, we do recommend a higher protein diet, just because protein can help with satiety.
What's a good source of plant protein?
Say that again, please.
What's a good source of plant protein?
Oh, I mean, peas are great. All vegetables have protein, but you got to eat a ton of it to do it. So,
right.
We try to eat a lot of lentils and beans at home. But you don't, kind of the amount of protein that Americans eat is way more than is necessary.
Got it.
So the amount of protein that the vast majority of vegetarians and vegans get is just fine. So I never really worry about a protein deficiency in these patients.
Doctor, thank you very much. Dr. Shah is from Texas. Visit him at primehb.com. All right, I'm Mark Alyn, and we're going to be back. Don't go away as Late Night Health continues.